This video will look at the CMR COOPS scheduling module. The scheduling module can be accessed by selecting Calendar on the main page. In order to create a new appointment, select New Event. Here you can see the details of the appointment, such as the date. You can specify the starting and end times, and also change the status of the appointment. In the middle of the page is a kind of search bar, and you can search for your patient here. Let's look for one of our DOE patients. And we can select Janice, and her information will populate here. We can select the procedure type, fill in the additional information here, and create a next. On the next page, the user has the opportunity to specify certain demographic information, record the height and weight, specify any allergies or any other details, the referring doctor, and they can also add any documents and save and next. The next page is fairly similar to the cardiac history page on a patient study page. Here you can indicate a patient's indication, record other aspects of their cardiac history, such as history of any heart disease, coronary risk factors, as well as other aspects of their history. Next subtab is medications. This is identical to the medication subtab seen in the patient study page. There's a separate video with more detailed instructions on how to use this page. The next subtab is accommodations. Here you can indicate whether the patient needs a taxi and indicate the pickup address and the pickup time. If the patient needs an interpreter, you can also indicate this here. The final subpage is instructions. Here, the user can specify whether there are any special restrictions with regards to the patient's diet. The user can also qualify the use of certain medications and specify which time the patient should arrive for registration. And there are also text boxes for making specific instructions or comments. Once you're done, you can save and exit. And we'll see the appointment in the calendar here. And this will also have created a new study for the patient. So if you go into their appointment and select study, it will take you to their official study page. The patient will also have been added to the study list, and so you can always access it from this page as well. Studies that have been created via the scheduling module will not have been assigned an accession number.